Hello and welcome. Today we're shedding light on a serious eye condition called Central Retinal Artery Occlusion, or CRO. Often referred to as an eye stroke, CRO can lead to sudden and significant vision loss. Join us as we explore the causes, symptoms, diagnosis, and management of this sight-threatening condition. So, what causes CRO? The primary culprit is a blockage of the central retinal artery, the main blood vessel supplying the retina. This blockage is usually caused by an embolus, a small clot or plaque that travels from elsewhere in the body, often the heart or carotid arteries, and lodges itself in the retinal artery. Less commonly, CRO can be caused by thrombosis, a blood clot forming directly within the retinal artery itself. Conditions that increase the risk of blood clot formation, such as high blood pressure, high cholesterol, diabetes, and certain heart conditions can all contribute to CRO. Let's delve into the pathophysiology. When the central retinal artery is blocked, the retina is deprived of vital oxygen and nutrients. This ischemia, or lack of blood flow, causes retinal cells to rapidly become damaged and die. The inner layers of the retina are particularly vulnerable. The macula, responsible for central vision, is often affected, leading to significant visual impairment. The extent of damage depends on the duration and severity of the occlusion, as well as the presence of any collateral blood flow. CRO is not a common condition, but it's important to be aware of its existence. It predominantly affects older adults, typically those over the age of 60. People with underlying cardiovascular disease, hypertension, diabetes, and hyperlipidemia are at significantly higher risk. Men are slightly more likely to be affected than women. While it can occur in younger individuals, it's usually associated with specific predisposing factors, such as drug abuse or certain autoimmune disorders. The most striking symptom of CRAO is sudden, painless vision loss in one eye. This vision loss is often severe and can range from a partial visual field defect to complete blindness. Some individuals may describe it as a curtain coming down over their vision. In some cases, a transient ischemic attack, or TIA, involving the retinal artery may occur, resulting in brief episodes of vision loss that resolve spontaneously. These transient events, known as a morosis fugax, should be considered a warning sign. Diagnosing CRO typically involves a comprehensive eye examination. The ophthalmologist will assess visual acuity, examine the retina with an ophthalmoscope, and may perform other tests. A classic finding is a cherry red spot on the macula, where the surrounding retina appears pale due to ischemia, while the macula retains its normal color due to its thinner tissue. Fluorescein angiography, a technique that uses dye to visualize blood flow, can confirm the blockage and assess the extent of retinal perfusion. Additional tests, such as carotid ultrasound and echocardiography, may be performed to identify the source of the embolus. While there aren't distinct types of CRAO in the traditional sense, it's important to distinguish between CRAO and branch retinal artery occlusion, or BRO. BRO involves the blockage of a smaller branch of the retinal artery, resulting in localized vision loss rather than widespread vision loss. The prognosis for BRO is generally better than for CRO. Also, ciliary retinal artery sparing or the absence of a cherry red spot may impact prognosis. Unfortunately, there's no universally effective treatment for CRO. The primary goal is to restore blood flow to the retina as quickly as possible to minimize permanent damage. Treatments aimed at dislodging the embolus or improving blood flow include ocular massage, carbogen therapy, inhalation of a mixture of carbon dioxide and oxygen, and anterior chamber paracentesis, removing a small amount of fluid from the eye. Intravenous thrombolysis, a clot-busting medication, may be considered in some cases, but it carries significant risks and must be administered within a very short time frame after the onset of symptoms. The efficacy of these treatments remains controversial, and the overall prognosis is often guarded. Management also focuses on addressing underlying risk factors, such as hypertension, diabetes, and high cholesterol. While CRAO itself is difficult to prevent directly, managing underlying risk factors can significantly reduce the risk. This includes maintaining a healthy lifestyle, controlling blood pressure and cholesterol levels, managing diabetes, and avoiding smoking. Regular eye exams, especially for individuals with risk factors, are crucial for early detection and management of any potential problems. Prompt evaluation of transient vision loss is also essential. The prognosis for CRAO is generally poor, with many individuals experiencing permanent vision loss. The extent of visual recovery depends on the duration of the occlusion, the severity of ischemia, and the timeliness of intervention. Recent research is exploring neuroprotective agents and other novel therapies to potentially protect the retina from damage and improve visual outcomes. However, further studies are needed to confirm their effectiveness. Advances in imaging technology are also aiding in earlier and more accurate diagnosis. While CRAO remains a challenging condition, Ongoing research offers hope for improved treatments and outcomes in the future. Thank you for joining us today and learning more about this important eye condition.